Hello, my name is Layla Thayer Malone. I'm the Program and Education Manager for the Ventura County office of the Alzheimer's Association, California Central Coast Chapter. I'm here to talk to you about how we can build dementia-friendly practices for residential and specialty care services. As awareness of dementia grows, we can all take action to create dementia-friendly communities for those living with the disease.
I'm Sylvia Taylor Stein, the Director of the Ombudsman Program for Ventura County. As the Director of the program, we oversee over 250 facilities in Ventura County, and we have many residents in our facilities who suffer from dementia. The Dementia-Friendly Ventura County training is designed to provide critical information and resources for those who work in the residential and specialty care sector. The Dementia-Friendly Ventura County movement aims to educate all members of the community on how best to serve individuals who are living with dementia, as well as their caregivers. This includes those who work in all assisted living and specialty care facilities, as we know it is vital to provide high quality care for all residents. We thank you for taking the time to complete this training and for your commitment to becoming dementia friendly.
An expanding spectrum of settings and services support people living with dementia, from long-term care facilities to assisted and independent living residences to home care, adult day services, and hospice. Any organization offering these services will be caring for people living with dementia. As the population of older adults continues to grow and demand for such services increases, organizations that commit to dementia-friendly practices and a whole person or person-centered approach will provide the highest quality care and have a competitive advantage in this expanding market. This presentation will give you some of the tools you need to help your organization become dementia-friendly. You can help your community become dementia-friendly by following these 3 steps. Prepare. Recognize the signs of dementia and be prepared to have difficult conversations with families who may be in denial. It's a good idea to identify leaders and ground-level staff who can be champions for dementia-friendly practices. This will allow their peers to learn by example, and in addition, it will give all staff an accessible resource to access when they have questions or run into difficult situations. Learn. Provide a structure for staff to receive ongoing education about dementia, communication techniques, and best practices. Incorporate dementia-friendly and person-centered practices into staff meetings, or encourage staff to take time to attend classes offered by other community organizations like the Alzheimer's Association. Create a working environment that celebrates meaningful connections between clients living with dementia and staff. Respond. Support people living with this disease and their families by providing referrals to appropriate resources such as occupational or physical therapists, legal and financial planners, and organizations that can help in making difficult end-of-life decisions. By following these 3 steps, you can help make your organization part of a dementia-friendly community. So what is dementia? Dementia is a general term for a loss of memory and other thinking abilities that is serious enough to interfere with activities of daily life. There are many causes of dementia, including stroke, Parkinson's disease, and traumatic brain injury. Alzheimer's disease causes the vast majority of all dementia cases, about 70%. Think of it like having a rash. The symptoms of many rashes are the same. Your skin gets itchy, irritated, and inflamed. But what is causing your rash? Is it eczema, or did you get into some poison oak, or is it because you're allergic to something in your detergent? It's the same with dementia. The symptoms are often very similar, but there are many causes. No matter what the cause, dementia is not a normal part of aging. It is a progressive, terminal disease of the brain that affects every aspect of cognition. When we talk about the signs of dementia, it's important to keep in mind that these are changes from usual behavior. If you, someone you love, or a client has always had trouble finding words when speaking, or often misplaces things, it might not be a concern when these behaviors persist in old age. but it is a concern in a person who has never had these problems before and is now experiencing noticeable changes in cognition. One of the most commonly known signs of dementia is memory loss that disrupts daily life. Losing your wallet and not being able to retrace steps to find it, forgetting names of close family members, not being able to remember how to get home from a familiar place. But many people with dementia also struggle to complete familiar tasks, have difficulty making decisions, and withdraw from social and work activities. A person with dementia may also experience changes in their personality, confusion with time and place, and trouble understanding visual images and spatial relationships. All of these are signs of dementia and should be taken seriously. If you notice changes in yourself, consult with your doctor. If you notice these changes in someone close to you or a client, consider having a conversation with them and their family to gently express your concern. An early diagnosis can bring relief by putting a name to what is causing these changes, so it's important to get to a doctor as soon as you notice changes. Getting an early diagnosis also gives the person more time to participate in important decisions about the future, opens doors to a number of resources and support services, and can improve clinical outcomes and medical management. Once you've identified these signs, or you know someone has received a diagnosis, it's important that you develop good communication skills so that troubling behaviors can be avoided and the person can remain engaged with life. The most important thing you can do is be patient. Dementia affects a person's abilities to find words, get thoughts out, and can also make it difficult to comprehend language. Never rush a person with dementia. Make sure you have plenty of time to talk with them and aren't rushing off to do something else. Here are some other tips to use when interacting with a person who has dementia. Maintain eye contact and be sure to get on their level when speaking with them. If they're sitting in a chair, it's a good idea to sit down as well so that you're on the same level. Speak clearly and listen closely. Be mindful of your tone and try your best to not sound condescending or hurried. Treat the person with dignity and respect. Keep in mind that dementia causes a lot of confusion, and confusion often causes agitation. If the person becomes agitated during a conversation, it may be time to pause so they don't get too overwhelmed. Take a break, and if they're up for it, return to the subject a bit later. Be aware of your body language. Dementia makes it difficult to interpret spoken language, so the person may rely more heavily on body language. This can cause opportunities for misinterpretation. For instance, if you're standing with your arms crossed and not smiling, you may be sending a message to the person you didn't intend. Put yourself in their shoes. Imagine how confused you would be if you had a diminished ability to interpret language, frequently forgot things, and became overwhelmed easily. This will help you to develop empathy, which is an important step toward connection. Apologize and redirect as needed. You may not have done anything wrong, but in the person's reality, they are owed an apology. Saying sorry and redirecting can be one of the best ways to validate the person's feelings and move on. Never argue with a person with dementia, and try your best to not become frustrated if they ask the same question several times. Remember that you may have heard the question 10 times, but your 10th answer is the first one they're hearing. If you answer with irritation, they won't know why. By following these tips, you can help avoid agitation, frustration, and anxiety, and you can help build a positive connection with the person. The most successful residential and specialty care organizations go beyond improving day-to-day interactions and fully commit to a person-centered and dementia-friendly philosophy at all levels. This starts at the top. Leaders within the organization should continually educate themselves on person-centered care and dementia-friendly practices to ensure that the organization is providing the best possible care to its clients. Everyone at the organization should understand that they are part of a wider community, not just within the organization itself, but in the city, county, and state in which they operate. Involving other community organizations to help educate staff can be a great way to foster this culture. It's also a best practice to keep staff assignments consistent, especially for clients with dementia. Consistency and routine can be comforting for a person living with dementia, and your organization can take steps to stabilize your workforce. More consistent staffing will also encourage staff to make meaningful connections with those living with dementia, which can help improve environmental factors that affect the person's quality of life, such as engagement in meaningful activities. Person-centered care model is one that emphasizes caring for the whole person, not just addressing their physical needs, but their emotional and social needs as well. The first step toward this is gaining an understanding of the person. What is their life history? What are their preferences? What are they still able to do themselves? What activities do they need assistance with? All of these things will be key pieces of knowledge that the caregiver can draw on to improve the person's quality of life. Getting to know the person is the first step toward building quality, positive relationships between staff and people living with dementia. These relationships will help staff to identify and anticipate triggers, which can reduce behavioral problems and other challenges faced by those caring for a person with dementia. It will also improve the chances that underlying problems will be detected. Things like urinary tract infections, depression, and anxiety can cause sudden changes in behavior and often lead to unnecessary and avoidable hospitalizations. Similarly, staff that can anticipate behavioral triggers can avoid the use of physical restraints and psychotropic medications. These methods to control behavior are not necessary if staff are aware of the person's triggers and are equipped with techniques to help de-escalate a situation. Staff should also be able to refer families and care partners to resources in the community that may help guide them through this challenging disease. Things like support groups, respite care, education and training programs, and coaching services can be incredibly useful for families who are feeling overwhelmed by the responsibility of caring for a loved one with dementia. Your staff can help them understand that they are not alone. Most people who have been diagnosed with dementia do not have a care plan in place. Your organization can help families build a comprehensive care plan by discussing care goals, values, and preferences. This care plan should build on the person's strengths and help them remain independent for as long as possible and improve their quality of life. The person's abilities should be reassessed regularly, and updates should be made to the care plan to reflect any changes in the person's abilities. Be sure to address all underlying medical conditions, including depression, anxiety, vision and hearing problems, and issues with mobility. Consider referring the person to a physical therapist to lower their fall risk and keep them healthy. It's also important to engage the person's mind through meaningful activities that fit with their personal preferences. Use a comprehensive assessment tool to determine what is important and interesting to each individual. All activities should involve physical activity, mental stimulation, and/or social interaction. Use your knowledge of the person to design appropriate activities for them. For instance, if you know your patient is artistic, consider activities that promote their creativity. Consistency in staffing and encouraging those staff to make connections with the person will also help them to promote good behavioral and psychological health. Staff that know a person well will be able to avoid the person's triggers for agitation and will be able to better interpret behavioral communication. Remember that as a person progresses in dementia, their ability to interpret spoken language and to express themselves through language will diminish. They will likely rely more heavily on behavior as a way to communicate. Caregiving staff that are aware of this and understand it will be able to better promote positive behavioral communication. If a person-centered care model is followed, pharmacological intervention will not be needed. Non-pharmacological interventions, like establishing a consistent routine, simplifying the person's living space by removing clutter, giving the person meaningful tasks or chores, and training caregivers and families to communicate, validate, redirect, and reapproach will make behavioral medications completely unnecessary. However, if you do resort to pharmacological approaches, Be sure to monitor the person for decreased functionality or cognitive abilities, sedation, falls, or delirium. Work with their doctor to wean or discontinue any medications that may be causing these changes. There are a number of ways that you can design your facility to promote independence and comfortability for people living with dementia. Use signs with large symbols or photos to help the person find their way around. Avoid complicated patterns in furniture, wallpaper, and floors. Make sure that there is high color contrast, especially in the restroom. A white toilet next to a white sink against white walls and white flooring will be tough for a person with dementia to find. Lower distractions by eliminating unnecessary announcements over your PA system, and use silent alarms to alert staff to safety needs without disturbing people with dementia. Provide access to spaces with minimum stimuli. For instance, you can set up a quiet space with limited stimuli that a person with dementia can go to when they feel overwhelmed. Consider giving access to outdoor spaces with safe, even walkways so that people with dementia can safely wander. Have a variety of activities available so that each person can find something to engage with that fits their personality. Lastly, utilize new technology that can help maintain a person's independence. Use things like motion sensors that trigger lights to reduce falls, tracking devices to locate a person quickly if they've wandered off, communication devices, and restroom alarms to let staff know when a person needs assistance. Most importantly, spread this knowledge and encourage your colleagues to adopt dementia-friendly practices. Talk openly about dementia and how to approach a client who has been diagnosed or is showing signs. Emphasize the importance of maintaining the person's dignity by maintaining their independence and utilizing alternative approaches to behavior problems. If you're able, consider partnering with advocacy groups, state or local agencies, and regulators to encourage the spread of dementia-friendly practices. If you need help, you can always reach out to your local area agency on aging to find resources and assistance. Here are some other local resources for people living with dementia, their caregivers, and all community members interested in creating dementia-friendly spaces. Reach out to the Alzheimer's Association, California Central Coast Chapter, for support groups, classes, care consultations, and more. We serve Ventura, Santa Barbara, and San Luis Obispo counties. For other resources for older adults, contact the Ventura County Area Agency on Aging. The Long-Term Care Ombudsman helps those living in long-term care facilities throughout the county. If you suspect that a person is being abused or neglected, contact Adult Protective Services immediately. You can also consult with a social worker if you're not sure what you're seeing is abuse. AARP offers a number of resources to older adults nationwide. And our 3 caregiver resource centers in Ventura County offer a number of different services that may be helpful for you, your clients, and their care partners. You can find more resources by contacting any of these organizations. Thank you for attending this presentation. We hope that it will help you to build a dementia-friendly community for your clients and their families.